My name is Anjali Mishra and I am an assistant professor at Noida Institute of Engineering and Technology, Pharmacy Institute, Greater Noida. So, today we are here to discuss Unit 4, that is Introduction of Suppositories, which is included in the syllabus of AKtU B Pharm first year, and it is coded as BP 103T. So, let us begin. Before beginning with any syllabus or any topic, let us start that what is the introduction of suppositories. So, as we can start here, suppository is nothing but it is a medicated form, it is a medicated solid dosage form. So, definitely it is a solid dosage form and it is a medicated solid dosage form because we are including medication or active pharmaceutical ingredient in it, and it is generally intended for use in the rectum, vagina, nose, ear and to a lesser extent the urethra as well. So, basically a suppository is a dosage form which is always inserted into the body cavity. That cavity could be anything, it can be the rectum, it can be the vagina, it can be the nose, ear and the urethra to certain extent. Moving ahead, after insertion they melt or soften at body temperature, because when we are inserting any kind of medication into the body cavity, it is very important for the medication to melt, because if they do not melt they are not going to produce any action. So, it is very important that they melt at body temperature. Now, here I would like to add that the body temperature of human is 37.5 degrees Celsius. So, it is also very important that the medicament must melt nearby this temperature only. As a result, it is very important to understand that whatever medication we are producing, it should melt at this range only. Moving on, vaginal suppositories often are called as pessaries. They are oftenly called as pessaries. So, and they are also made into compressed tablets that disintegrate into body fluids. Now, let me be very clear that as I have stated here, a suppository is nothing but it is a medication that is oftenly inserted into a body cavity. So, whenever the suppositories are inserted into rectum, into vagina, into nose, into ear or into any of the body cavity, they are majorly called as suppository. However, here I would like to include one very important thing, that whenever suppositories are inserted into vagina, they are not called as suppositories. In fact, they are known as pessaries. So, here it is a very important thing that is to be noted. So, clubbing this slide, I would like to say that suppositories are medication or it is a medicated form that are usually made in order to insert into the various body cavities. Moving ahead, as we can see, here are various types of suppositories that are mentioned on the slide. Let us understand each and every suppositories in a bit detailed way. So, initially and the very first type of suppositories are nothing but your rectal suppositories. So, rectal suppositories are those kind of suppositories which are meant to be inserted into a rectum cavity of human being. Moving on to the another one. Here is our vaginal suppositories. These are the second type of suppositories which are inserted and which are made to insert into the vaginal cavity. Now, as I have discussed in the previous slide, this vaginal suppositories are also known as pessaries. So, this is a very important thing that is to be noted. Moving on ahead, there is another type of suppositories which are known as urethral bogies. Basically, whenever there is any kind of diseases or discomfort or any ailment that usually occurs into the urethral cavity, so that are nothing. So, in that cases what do? We make urethral bogies, and here what do? We insert urethral bogies into the urethral cavity, as we have discussed in our first slide as well. Moving on ahead, there are another type of suppositories which are known as nasal bogies. Nasal bogies are meant to be inserted into the nose or to the nasal cavity whenever there are various discomfort or disailment of nose, for example in chronic sinusitis. So, sinusitis, as we know that it is a condition which occurs basically in the nasal cavity. So, in that cases we also insert nasal bogies. Moving ahead, ear cones. If there is any ailment, disease in the ear, so to be more precise, to be more local, to produce more local action, what do? We make local ear suppositories, and instead of giving the drops, instead of giving any sort of ointments and many more things into the ear, we make ear cones. So what ear cones will do, ear cone, when you make a suppository of ear cones, they will be solid at room temperature, and as you make the suppository, as you insert them into the ear cavity, what is the main thing that is going to happen? It is going to melt at 37.5 degrees Celsius, and as the suppositories melt, they definitely are going to produce an action which we want a desired action in order to treat a particular ailment. As a result, these are some of the types of suppositories that we have gone through. Just a quick revision. So the types of suppositories that we saw here are rectal suppositories, vaginal suppositories, urethral bogies, nasal bogies and ear cones. Moving on ahead. So, as we know that each and every thing has its two important sides, that is merits and demerits. So, in the same manner, our suppositories also has its own advantages and disadvantages. So, now we are here to study the advantages of suppositories, which starting with this one, that oral route not useful. So, suppositories are preferred whenever there is issue with the oral route, whenever the oral route proves to be not that efficacious. At that cases, we go for suppository routes, because suppositories are such kind of medication that is going to produce your local action as well as systemic action. However, there are certain cases when the patient is not fit to consume orally. So, in such cases, we are not going to offer the patient any medication through oral route. So, whenever, for example, if the patient is unconscious, so in that case we are going to offer suppository not through the oral route, but through any other cavity through which we need to administer the particular suppositories. So, whenever, this is a very important point, whenever we do not have feasibility of delivering a drug through the oral route, we go through this suppository route. Moving on to the next advantages, GIT problems, nauseous and post-operative. So, if any patient is suffering from any kind of gastrointestinal issue, so in such cases we are not allowed to give a patient any medication through the oral route, because if we give the medication through the oral route, that patient is unable to digest the medication, or the patient is unable to give a 100% effect to that medication, the medication is not able to provide a 100% effect to the patient. So, in such cases we are not supposed to give any medication if there is any sort of GIT problems. Moving on here, if the patient is nauseous, if the patient is very much prone to vomiting, then in that cases also we are not supposed to give medication through these routes. So, here the suppositories prove to be a very boon for us, because suppositories are inserted into the body cavity. So, even if the patient is suffering from any sort of GIT problems, or if the patient is going through any sort of nausea effect or any sort of vomiting effect, so that can also be minimized or can be lessened. Moving on, if the patient has gone through an operation, if the patient is if the patient has gone through any operation, if there is an post surgery done to it, then post surgery the patient has already gone through a lot of trauma throughout the surgery. So, it is actually very difficult at that time to provide the patient through medications which are on oral route. So, in such cases also the suppositories prove to be a boon for us. So, these are some of the another advantages of providing suppositories to a patient who are suffering from GIT problems, or who are having nausea, or the person or if the patient is suffering from any sort of post-operative issues. Moving on ahead, this is a very important point that is discussed here. Our suppository has the ability to avoid the first pass metabolism, as we are very well aware that the medications avoid the first pass metabolism. So, it is very important, if the medication is going through the first pass metabolism, then what happened is the medication are not that efficacious, because they lose their some sort of potency, or they lose their some sort of effect. So, if our medication has the power to pass this first pass metabolism, it means the efficacy of our medication can be extended, can be enlarged to a huge extent. So, this is a very important point of suppository that is to be noted. Moving on to another advantage, drug with unpleasant taste, bitter odor can also be administered. So, it's a very important point. If a medication has got an unpleasant odor, unpleasant taste that is completely unacceptable by our patients. So at such cases, the administration of that particular medicament becomes really very difficult. So it is very important that instead of making the patient feel guilty about taking that medication, we can also always go for the route that are very much targeted to that particular organ. Here I would like to quote an example here, that for example, if a patient has is very much prone to a medication that is being taken for constipation. So if a person or a patient is suffering from constipation, we are not supposed to give him the medication that can only be taken through the oral route, because in such cases, if the patient is prone to or if the patient has got irritation with that kind of medication, so it is very difficult to make the patient compliant with that medication. So in such cases, instead of going for the traditional forms, we can always refer a suppositories that can also give you a local effect and can also minimize the unacceptance of our medication or dosage form. Moving on ahead, any sort of unstable drug that is being susceptible to pH, to gastric attack can also be avoided. For example, if we are delivering a medication which is not feasible inside the body or which is oftenly attacked by our gastric juice, so what happens here is the efficacy of our medicaments really goes down. So in order to avoid the efficacy going down, we can always choose a drug, or we can always avoid this instability of the drug by making the drug to avoid the passing through that gastric pH. So we can avoid the first pass metabolism, we can always avoid any sort of sensitive or any kind of pH attack on our drug. Now, drug having GI side effect, any sort of medication which is going to produce a side effect of gastrointestinal cavity can also be avoided, because we are not giving the drug into the GI tract. So obviously, if the drug does not enter into the GI tract, it won't give you any side effects which is going to produce into the GI tract. So that is also a very great advantage of our suppositories. So clubbing this advantage, first of all, oral route, whenever it is not useful, we oftenly go for suppository route. Another, it is also feasible for GI patients, post-operative patient and a patient who is always having problem with of nausea, of vomiting. Then if any suppositories have major disadvantages, that it has the power to abolish or to avoid the first pass metabolism. So in that cases also we can administer our suppositories. Moreover, any drug having bitter, unpleasant taste can also be avoided. And clubbing with these two things, that if our drug is susceptible to high pH or to it's very sensitive, so in such cases also we are also becomes liable to formulate our suppository to formulate our medication into a suppository rather than giving it through from a normal route. Then eventually clubbing it with any sort of advantage that a drug is going to produce into the GI tract can also be avoided by these methods. Moving on ahead, as I discussed earlier, each and everything has its advantages and disadvantages. So here also we are as we have just seen the various advantages of our suppository, there are various disadvantages also. Moving on to the disadvantages of suppositories, mucosal irritation. Mucosal irritation, because whenever we administer suppository to locally, when we administer suppository to a particular cavity, the mucosa is present into that particular cavity. Now, the drugs often are susceptible or they are liable to cause irritation. So sometimes what happens, continuous exposure of that mucosa to that particular drug may cause mucosal irritation of that particular tissue. Moving on ahead, leakage. Leakage is the very important problem that is really unavoidable, because whenever we are saying that we are making suppositories and it is going to melt into the body cavity, so definitely if it is going to melt, it is going to get converted into a liquid state, and it is an orifice, it is a cavity, and definitely if anything gets converted into a liquid state, it has the issue of leakage or oozing out from that particular area. So this is one of the important disadvantages of suppository, because if all the medicaments will get leaked out, what percentage of medication is there to actually help the patient or help the person to actually heal him or her. Moving on towards the next disadvantages of suppositories, stringent storage condition. As we are continuously mentioning from the first slide that they oftenly melt at 37.5 degrees Celsius, that is at human body temperature. So, what if the temperature of the surrounding exceeds, or what if the temperature of the surrounding comes below 37.5 degrees Celsius. So, in such cases what happens is various stringent storage conditions are required. If the storage conditions are not properly maintained, what happens here is there are various issues that may cause our suppositories to soften, to melt, to not have its proper effect, and there could be various issues that may lead to defectives to actually that may lead to actually very defective sort of suppositories formation if the storage conditions are not properly maintained. Moving on towards the next disadvantages is feeling of discomfort. Obviously, this can't be eliminated because whenever you insert suppositories into a orifice, into a body cavity of a patient, if the patient is pediatric, then this thing can be eliminated to a certain extent. However, even children won't find it easy to take or to make anyone insert anything into their body cavity, because definitely it is a feeling of discomfort. So, it is actually very difficult for a patient to convince in order to take suppositories, because it is definitely an embarrassing situation for any patient to want any sort of medical professional to insert any sort of substances into their body cavity. So, definitely this is one of the important factors that is going to affect the disadvantages of suppositories, that is feeling of discomfort, and definitely this can't be eliminated because as we are saying that suppositories are intended in order to melt it into the body cavity. So, in fact they are also inserted into the body cavity. Moving on ahead, large scale productions are difficult and costly. Definitely, because as suppositories are often made with very precise calculations, stringent storage condition. So, definitely if we want to produce suppositories on a larger scale, on a huge quantity, then the making of suppositories becomes really tedious and very difficult, and at the same time it is very much expensive and it causes huge expenditure of a particular firm or of a particular individual, because the production is very difficult, the storage conditions are very difficult, various sophisticated instruments are also employed in these kind of scenario. Now, discussing the last disadvantages is the bronchitis. This is a condition in which there is an inflammation of the region of the rectum. As I discussed, suppositories are nothing but they are something that are inserted into body cavity. They are inserted into body cavity. So, if a patient is continuously being exposed to a certain kind of medication that is being inserted into the body cavity, then there are actually various issues related to that. So, if a person is continuously being exposed to a certain kind of drug which is useful in producing or which is useful in reducing the bronchitis of a patient, that patient is definitely going to develop an inflammation of that particular area. Because if we expose a particular area to any kind of medication, it becomes really difficult for a patient to, or if it becomes really difficult for any individual to actually absorb that thing, because continuous exposure may cause irritation or inflammation of the particular lining of that particular organ. Moving on ahead. Now, let us discuss about different sizes of suppositories, because as we have discussed earlier that suppositories are inserted into various body cavities like eye, ear, nose, vagina, rectum, urethra. So, depending upon the organ of insertion, the size of the suppositories may vary. So, here is a tabular representation of the size of the suppositories and the use of the suppository. Let us have a quick look into this. Size, if the size is 0, then the suppositories is used for the children. If the size ranges from 1, 2 and 3, then the suppositories is majorly used for rectal use. If the size is labeled as 4, then the suppositories become useful for as a pessary. Here I would like to remind that pessaries are nothing but they are vaginal suppositories. They are nothing but the vaginal suppositories. Now, here is another size mentioning as A and B. So, here A and B size stands for nasal and urethral bogies. So, no confusion, because bogies are nothing but they are a type of suppositories. So, in order to understand these sizes in a more deeper way, here is a diagrammatic representation of the size of the suppositories. Here is the size 0, then which is oftenly useful for children, then size 1, 2 and 3, which are useful for rectal use, because whenever we want to insert any sort of substances into the rectum, the size that is required will be completely different when it is inserted into any other body cavity. So, as you can see, 1, 2 and 3 have got a needle shaped size, just to facilitate the administration, just to facilitate the transportation of medicaments, or just to for easily administration, I can say. Then moving on towards size 4. Size 4 is completely different from any of the sizes that we can see here. Size 4 is majorly useful for pessaries, because the size that is that we require for insertion into the rectal cavity is definitely not going to be the same for insertion into the vaginal cavity, because the leakage, then the discomfort is going to differ from organ to organ. So, definitely here, as we can see, this is the size that is going to be for vaginal suppository, oftenly called as pessaries. Then moving on towards the size A and B. Size A and B are even more conical, because they are inserted into the nasal and urethral bogies. The size shape plays a very important role, then because it becomes very important, because where you are going to insert this, suppository is of prime importance. Moving on ahead. Here is nothing but different shape of suppositories: round oval, long oval, teardrop, bullet and tampon. So, depending upon the type, or depending upon the organ where you want to administer the suppositories, it becomes very important. As a result, these are some of the shapes of suppositories. Moving ahead. As we are discussing a detail on suppositories, let us understand what are the properties of an ideal suppository. Ideal is nothing but that everyone needs, and let us understand the properties of an ideal suppository. First, it should be stable at room temperature. Definitely, the suppository that we make should be stable at room temperature, because if they aren't stable at room temperature, we won't be able to take most out of it. So, it becomes very important that it is stable at room temperature. Moving on, suppository must have the power to melt at body temperature. If they do not melt at body temperature, it becomes very difficult for us, because until they melt, they are not going to produce action. So, it is very important that they melt at body temperature. Moving on, they should, or they must release maximum amount of drug, because in order to produce a desired action, it is very important that they release the maximum amount of drug. So, that is why it must be able to release the maximum amount of drug. Then it should disintegrate at site of administration, because we are saying that suppositories are oftenly given for local action. Hence, whenever we are inserting the suppository at the site of action, they are supposed to get disintegrated at that particular site only, because whenever they will disintegrate, definitely they are going to be absorbed by the mucosal lining of the things, then only they are going to enter the bloodstream. So, disintegration of the suppositories plays a very vital role in order to produce a biological action. Moving ahead, suppositories bases. Now, what do you mean by suppository bases? Suppository base, or any sort of base, is very important when you want to make anything on it. So, if we want to manufacture suppository, it is very important that we have a suppository base. So, suppository base are nothing but they are the largest portion of the suppository which is going to take or occupy of the suppository. So, it is the largest portion of the suppository. Moving on, they play a very vital role in maintaining the shape, solidity or firmness of a suppository when they are inserted into the body cavity, because whenever we are inserting anything into the body cavity, initially it should be firm, solid, and it should have a very rigid structure, because if the rigid structure is not maintained outside the body, they are going to be very fragile, or they are going to be very brittle. So, it is the base that plays a very important role in maintaining the rigidity, the firmness, the solidity of that suppository. So, suppository base plays a very important role. So, it becomes very important point. So, there are large number of bases, but theobrommo oil, glycerol, gelatin base and PEG plays a very important role in the requirement of suppositories. So, here the names that we saw are nothing but they are the types of bases that are usually accompanied while making suppository, which we are going to study in the next lecture. Then let us have a quick view on ideal properties of bases. Ideal properties is that definitely they are supposed to maintain the shape and size of the suppositories. It should melt at body temperature. Definitely it should be non-irritant, because if it causes irritation, it is going to produce a issue on our the lining of the particular organ. It should shrink easily in order to get removed from the mold. Yes, it should be able to shrink easily, because if they aren't able to shrink easily, they are going to produce a suppository which is not of good appearance, or which does not have a good aesthetic appearance. And appearance of suppository plays a very important role, because it is being accepted easily by the patient. Then it should not interfere in release or absorption of the drug. Any sort of material must not interfere into the absorption or in release of any drug. Basically, whatever we need, that our base should be inert. Inert is what we need, because inert, if our base is inert, it is definitely not going to be definitely not going to interfere in the production of bases, in the formation of bases, or in the formation of suppositories. Moving ahead, it should permeate incorporation of drug, because our drug is nothing but it is a main API, and definitely our base should be much flexible, that it facilitates the transportation of API into the drug. Then it should be compatible with variety of drugs, whatever kind of suppositories. If you want to make, for example, if you want to make antibacterial suppository, then antibacterial API must be easily and compatible with your base. So it should be very much compatible with all classes of drugs. Then it should be physically stable with storage condition. Definitely, as we know that storage of suppository is a major hindrance in making or in stabilizing suppositories. So whatever base we are using in order to formulate the suppositories, that plays a very important role. So definitely an ideal base should be very much physically stable while storing condition also. Then it should not harden or soften on storage. It should definitely not harden too much while storing, or it should not become too soft on storage, because that is going to produce a problem. Then our suppositories is not going to have a proper effect. Then its storage condition might be issues. It will not have a proper effect. It won't melt if it becomes too hard, or if it will be totally in liquid state if it becomes too soft or too liquidy. So this is a very important condition that is to be kept in mind. So that's all about suppositories, bases of suppositories. We will have a detailed discussion on types of bases and the various types of bases that are incorporated into the formation of suppository in the next lecture. So I hope all of you must have understood what are suppository, advantages, disadvantages, types of suppositories, and different sizes of suppository. So thank you so much.